Our kidneys are remarkable organs. They are not just simple filters. They are complex and vital components of our body's overall health. They work tirelessly, filtering waste products from our blood, a process that is essential for maintaining our body's internal environment. In addition to filtering waste, kidneys also play a crucial role in maintaining the delicate balance of fluids and electrolytes in our bodies. This balance is vital for the proper functioning of our muscles, nerves, and other tissues. However, certain conditions, such as diabetes and hypertension, can gradually damage the kidneys. Over time, this damage can lead to a condition known as end-stage renal disease, or ESRD. In ESRD, the kidneys lose their ability to perform their essential functions. When the kidneys fail, toxins and waste products begin to accumulate in the bloodstream. This buildup can cause a range of serious health issues, including fatigue, swelling, and difficulty breathing. This is where dialysis comes in. Dialysis is a medical procedure that mimics the function of healthy kidneys. Dialysis acts as an artificial kidney, removing waste products, excess fluids, and salts from the blood. It essentially takes over the role of the failing kidneys, ensuring that the body's internal environment remains stable. For individuals with ESRD, dialysis becomes a lifeline. It allows them to live longer and healthier lives by performing the critical functions that their kidneys can no longer manage. Dialysis is not just a treatment, it is a bridge to a better quality of life. It provides patients with the opportunity to continue their daily activities and maintain their independence. It is a critical treatment that bridges the gap between failing kidneys and the possibility of a kidney transplant. For many, dialysis is the only option while they wait for a suitable donor organ. There are two main types of dialysis: hemodialysis and peritoneal dialysis. Each type has its own unique process and benefits. Hemodialysis involves using a machine to filter the blood outside the body. This process typically takes place in a dialysis center where patients visit several times a week for treatment. On the other hand, peritoneal dialysis uses the lining of the abdomen or peritoneum as a natural filter. This method can often be done at home, providing more flexibility for the patient. Both methods require a way to access the bloodstream, and this is where the arteria venous, or AV fistula, plays a crucial role. The AV fistula is a surgically created connection between an artery and a vein, providing a reliable access point for dialysis. The choice between hemodialysis and peritoneal dialysis depends on various factors, including the patient's medical condition, lifestyle, and personal preferences. Both methods have their own advantages and challenges. It is important for patients to work closely with their healthcare team to determine the best dialysis option for their individual needs. This collaborative approach ensures that patients receive the most effective and personalized care possible. While dialysis is a life-saving treatment, it is not a cure for ESRD. The ultimate goal for many patients is to receive a kidney transplant, which can restore normal kidney function and eliminate the need for dialysis. A successful kidney transplant can significantly improve a patient's quality of life, allowing them to return to a more normal and active lifestyle. However, the availability of donor organs is limited, and many patients face long waiting times. In the meantime, support from healthcare providers, family, and support groups can make a significant difference in the lives of those undergoing dialysis. Emotional and psychological support is just as important as medical treatment in managing ESRD. With the right care and support, individuals with ESRD can lead fulfilling lives. Dialysis, while challenging, offers a pathway to stability and hope for a better future. Understanding end-stage renal disease and the need for dialysis is crucial for patients and their loved ones. It empowers them to make informed decisions and take an active role in their healthcare journey. An AV fistula is a surgically created connection between an artery and a vein, typically in the forearm. This procedure is essential for patients who require long-term hemodialysis, as it provides a reliable access point for the treatment. This connection allows for increased blood flow through the vein, making it larger and stronger. The increased blood flow is crucial because it ensures that the vein can handle the high volumes of blood needed for effective dialysis. The strengthened vein can then be used repeatedly for hemodialysis treatments, which are typically required multiple times a week. This repeated use is possible because the vein becomes more durable and less prone to complications, with needles inserted to draw and return blood to the body. The process involves inserting 2 needles into the fistula, one to draw blood out to the dialysis machine and another to return the filtered blood back into the body. Creating an AV fistula is a relatively straightforward surgical procedure, but it requires the expertise of a skilled vascular surgeon to ensure the best outcomes, usually performed under local anesthesia. This means that the patient remains awake but does not feel pain in the area where the surgery is performed. A vascular surgeon connects an artery, typically the radial artery near the wrist, to a nearby vein, such as the cephalic vein. This precise connection is critical for the success of the fistula to a nearby vein, such as the cephalic vein. The choice of vein and artery can vary depending on the patient's anatomy and the surgeon's assessment. This connection redirects blood flow from the artery directly into the vein, significantly increasing the blood flow through the vein, causing the vein to enlarge and its walls to thicken over time. This process, known as maturation, is essential for the fistula to become usable for dialysis. The fistula takes time to mature, as the vein needs to adapt to the increased blood flow and become strong enough to handle the dialysis needles. Usually several weeks to a few months, depending on the individual patient's healing process and overall health, before it can be used for dialysis. During this time, the patient may need to use a temporary catheter for dialysis until the fistula is ready. During this maturation period, the vein adapts to the increased blood flow, becoming more robust and better able to withstand the repeated needle insertions required for hemodialysis. This adaptation is crucial for the long-term success of the fistula, becoming more robust and better able to withstand the repeated needle insertions required for hemodialysis. The durability of the fistula is vital for patients, as it reduces the risk of complications and ensures a more effective dialysis treatment over time. The creation of an AV fistula is a meticulously planned and executed surgical procedure, essential for patients requiring long-term hemodialysis. It begins with a thorough medical evaluation, including a comprehensive review of the patient's medical history, a detailed physical examination, and advanced imaging studies to assess the health and suitability of the blood vessels in the arm. These steps are crucial to ensure the success of the procedure. Once the surgeon determines that the patient is a good candidate for an AV fistula, the procedure can be scheduled. This decision is based on multiple factors, including the size and condition of the blood vessels. On the day of the surgery, the patient is typically given local anesthesia to numb the area where the fistula will be created. This helps to minimize discomfort during the procedure. The surgeon then makes a small incision in the skin to access the underlying artery and vein. Precision is key at this stage to ensure the best possible outcome. Using specialized instruments, the surgeon carefully connects the artery and vein, creating a passage for blood flow between them. This connection allows for the increased blood flow needed for effective dialysis. The incision is then meticulously closed with sutures, and a sterile dressing is applied to protect the site from infection and promote healing. The entire procedure usually takes about 1 to 2 hours to complete, depending on the complexity of the case and the patient's individual anatomy. Patients are typically able to go home the same day or the following day, but they will need to follow specific post-operative care instructions to ensure proper healing and function of the fistula. Post-operative care includes keeping the surgical site clean and dry, monitoring for signs of infection, and avoiding heavy lifting or strenuous activities that could strain the new fistula. Follow-up appointments are crucial to monitor the fistula's development and to address any complications early. The healthcare team will check the fistula for proper blood flow and overall function. Once the fistula has matured, which can take several weeks to months, it will be ready for use in hemodialysis. The mature fistula provides a reliable and efficient access point for dialysis treatments. Patients should maintain regular communication with their healthcare providers to ensure the long-term success of the fistula and to manage any issues that may arise. With proper care and monitoring, an AV fistula can significantly improve the quality of life for patients on dialysis, allowing them to maintain an active and fulfilling lifestyle. The healthcare team plays a vital role in supporting the patient throughout the entire process, from pre-surgical evaluation to post-operative care and ongoing dialysis management. Patients often express gratitude for the care and expertise provided by their healthcare team, recognizing the significant impact of the AV fistula on their overall health and well-being. Section 5, AV fistulas, the gold standard for dialysis access. AV fistulas are considered the gold standard for dialysis access for several reasons. Firstly, they offer superior longevity compared to other options, such as arteriovenous grafts or central venous catheters. AV fistulas, once mature, can last for many years, while AVGs and CVCs have a higher risk of complications and may need to be replaced more frequently. Secondly, AV fistulas are associated with a lower risk of infection compared to AVGs and CVCs. This is because AV fistulas use the patient's own blood vessels, reducing the risk of introducing foreign materials into the body. Infections can be a serious complication of dialysis access, leading to hospitalization and other health problems. Thirdly, AV fistulas provide better blood flow for dialysis, resulting in more efficient treatment. The increased blood flow through the fistula allows for a higher rate of dialysis, meaning that patients can spend less time connected to the dialysis machine. Thank you for watching. Write in comments section if you have any question and we will be happy to answer. Subscribe with our great channel, Medical Sales Mastery. We are here to support your journey.